be putting everyone in order momentarily.
Okay. All right. Okay. Good afternoon, almost evening. Actually, it's evening. Welcome to the Insurance and Pharmaceuticals Subcommittee and to the unpredictable schedule of crossover week. So if you are out there watching us, we're glad that you are interested and engaged and that you were patient in waiting for this. We have 4 bills on our agenda today. 2, I believe, are ready to go. There's been a lot of work on these 2 bills with all of the advocates and the sponsors. And I'm hoping that today those 2 bills we can wrap up and get ready to be on the floor tomorrow. The other 2 bills I think we are going to need to discuss more. We've gotten recently some new information, and we will need to review it as we determine where to go next with these bills. So we're going to begin with House Bill 374, Health Insurance Pharmacy Benefit Managers, Audits of Pharmacies and Pharmacists. And Lisa, you want to tell us what the changes are in this bill since the last time we saw it?
So I believe the only difference in the reprint itself is on the last page, on page 8. This was the language that MIA had expressed some concerns with. And then I think the pharmacist wanted some clarification on it. So this is below line 10, section 2, and it's just, the point of it is to make sure the enactment date is, or when it will apply, the applicability is clear. And it says it will apply to any audit after January 1st, 2024, except for if it's a state or local government that's contracted with a pharmacy benefit manager. And then it will apply to audits on the first day of the first plan year or the first time a contract between a PBM and the state or local government is amended or renewed on or after January 1st, 2024.
Okay. Is there anybody in the meeting that has a concern or question about that language? We're talking about page 8 of 8, what's section 2 under line 10. Okay, seeing none. The other outstanding issue that we had.
So
Yes.
It's Bob Enton. Sorry to on that change that deals with the effective date. Why is it okay? You know, to what I heard the other night was that the industry thought that the bill should apply to contracts entered into one or after, and then we said or amended. And that's where we left it after January 1. And if I understand what you're saying correctly, now the language would say it applies when January 1, except if you're a state or local government, then it applies when the new contracts plan year goes into effect. So why that difference? Why is the private sector being treated differently from local and state government? That's my question.
I'm going to ask someone on the call from the MIA.
I mean, I'm just going to say that I think
okay.
just first though, and then you can let MIA talk, but some of the concerns that were expressed had to do with specifically the local governments and them giving them extra time. And then the rest of it was worked on with MIA, and it did involve possible ERISA concerns, which they can explain.
Okay, is David Cooney on the call?
I don't think David could make it.
But Mary is. So Mary Quay,
Yes, if
a solid second.
Van is on here too.
Our Van, okay.
that may be more helpful, but I think our concern is to express it most accurately. And we heard a number of concerns that there could be difficulty in interpreting it. And
Right.
also that we want to it concerns the contracts primarily between APBM and the pharmacy.
Hey, excellent.
Delegate Taveras, thank you. I'm sorry, go ahead, Mary.
I'm reading the notes quickly. So it is also that we are concerned about which contracts would be affected, and we don't want to get into the ERISA contracts with the ERISA plan necessarily, especially if it's more concerned with the contracts between the PBM and the pharmacy. And so we thought that this was a clearer way to state it.
Okay, thank you. So I think this, if I can say it, how I interpret it is that this is really trying to protect us from litigation with regard to overstepping our bounds with regard to the actual plans. Is that right?
Correct.
Van, am I right with that?
Yes, we want
Okay.
clarity and to avoid litigation.
Thank you.
over the ERISA issue.
I always try to do that. Kim Robinson.
I'm so sorry to have a question on this, Madam Chair. I was the person who initially had requested the change in the effective date, and the language I provided to Lisa from the previous bill would have applied to both the business community and the counties. I had understood the MIA's concern was with the drafting where the county, I'm sorry, just so you know, that's not my background noise. Someone else's mic is doing that. Was that the way it was drafted with respect to the counties was questionable because they don't meet the definition of a health and welfare benefit plan, which was actually drafted more specifically to the ERISA plans. To what Mr. Enton said, you know, I would have expected that this came back to say that it applied to contracts reviewed on or after with language that sort of addressed both the business community and the counties. It is no less disruptive for a business who has already committed to a contract and a price for their contract to have their contract disrupted mid-plan year either, which is why historically we do not do that in the state. Historically, we do follow the renewal or the amendment of the contract. And so even for those businesses who've never been subject to this for some of these provisions, this would be unusual, and it's not what we did to them the last time. So that's my thought. I just think it's kinder to our businesses who are being impacted to follow sort of their contract or amendments as well.
I would ask that you make sure your microphone is on mute unless you are talking, please. So how does
And
this?
I don't think that's a dramatic change. Oh, I'm sorry, Madam
Okay.
Chair.
Yeah,
I
well,
don't
that's
think
my
a dramatic
question,
change
Kim.
to this language. So I
Okay.
think if the committee is amenable, I will sit here right now and send a tweet to both Lisa, Van, and Mary Quay, because I don't think that's a dramatic change from what you have here. It just pulls in the businesses to also allow them that same courtesy.
Okay, can you do that quickly while we talk
Yes.
about the other issue?
I will do my best to do it right now.
I don't know if Van has anything he wants to add to this,
Oh,
though.
Van?
The issue and the
I do. I think one thing that we're sort of missing here is that this bill does not impact the plan design.
Right.
This is not impacting the underlying contract of insurance or the self-insurance. Rather, it is really between the PBM and the pharmacy. And so that's what the audit relates to. So, frankly, it doesn't really impact the plan. We were asked to carve out something for the government plans. So that's why that's in there. But in terms of the start date, it's not really the underlying contract that is being regulated here.
MIA originally came back to us with just saying that this entire bill would apply to any audit after January 1st, 2024. And it would be the same for the counties and
Okay.
I mean, it would be the same for everyone. That was the original language they came back to me with.
Van, do you
Based
want
on what you had drafted, Kim, that was what they came
Yeah.
back to.
Look, not to beat a dead horse, but if I could, Madam Chairman, just seems to us that if, if it affects, ultimately whatever happens has the ability to impact the consumer. And whether the consumer, the employees and employees of state or local government, or, Acme company, it just seems to me it ought to be, if it's makes sense to do it for state and local government, why does it not make sense to do it for the business community? That's the point.
Okay, I'm gonna go to Brian. Brian Host, please.
Hi, Madam Chair. Can you hear me okay? I'm sorry about the background noise.
Yeah.
Stuck in an airport. The only problem we have with that provision is that if we don't know when they start, we have no way of knowing when it applies. So by having a date, and at least with the state plans, we know when they roll over. So with all of the private plans, they could start January 1, it could start a year later, it could start 2 years later. We don't have any way of knowing when that would be applicable, and they'll extend it as long as they possibly can for sure. So I think that if you're going to do something around that, you have to still have a hard and fast date that after this date, no matter what you do, it definitely applies.
Well, we have the date of January 1st, 2024. That's when it would apply after that. That's currently in language. I'm going to go to Delegate Kipgate because.
Thank you, Madam Chairman.
Yes.
I think it might be Mr. Enton's feedback that we're all hearing. I would just say that this is much to do about nothing. January 1 for everybody would be my preference. Remember, this is just about how the audits that are how audits behave in the pharmacy. I don't really see how it impacts the payers or the government or the business. So I'm happy to support the amendment as you have it currently, Chairman, but my preference is January 1 for everybody to make it neat.
Okay, thank
Madam
you.
Chair, can I explain how
Kim?
it does in fact impact?
Okay,
Because I think there's a lot of lack of understanding because, of course, this is not something the state has line of sight into. However, purchasers who have not traditionally been regulated by the state often craft their own specific audit requests for what we're looking at, what the expectation in terms of what that assessment is going to be, because they are often customizing their programs. And while Mr. Dorsey is correct that it doesn't affect plan design, it does not mean it has no impact on what the contract between the payer and the PBM requires where audits are concerned. And so we're saying, we're not saying you can't make changes to what that expectation is, but we are saying that if we are now in a legal contract that the state is going to come in and override in the middle of it when there are expectations that do not align with this law, it is challenging us for us as a business working with another business who is going to now experience this for the first time. And to simply say, and to include Mr. Wiener's amendment language, I don't know any business who is signing an evergreen contract with any contractor ever. I know that's sometimes experienced in the provider space, but businesses who are coming to us for us to do business for them are not typically in the habit of saying, we're going to just pay you forever with no new contract. That doesn't really happen on that side. So saying the amendment part does also address that, but this is not without impact to those agreements. And I'll stop there, Madam Chair.
And Kim, as I'm looking at it, it says the first plan year beginning after January 1, 24, or the first time a contract between a pharmacy benefit manager is amended or renewed. So the flexibility is there in terms of, in terms of when the contract is amended or renewed, whether, and I think I just heard you say that local governments are not doing evergreen contracts.
Nor are private businesses.
And nor are private businesses. So
BG is not hiring anybody with an unlimited contract. It just doesn't.
Right. So I think that, I mean, my understanding is, and maybe I'm just not, maybe I'm just tired, but I think we've met, and at least with respect to local and state government, we've met the concern that you have with this language. So
just not for the rest of your Maryland businesses whose contracts are also impacted. So I'm only asking for all of the businesses your bill is going to touch. That's all.
And MIA said we should not do it that way. So that was
yeah. So we're gonna follow MIA on this one. Steve, I just said we're gonna follow MIA on this one. Are you okay with that? Okay, then other outstanding issue we had was on page 3 of 8, lines 11 and 12. And I understand there's been some discussion, and I think Delegate Kipke, you have a proposal on this?
Thank you, Madam Chairman. I would like to solve this issue so that product that's not expired, I mean, that's my preferred path forward, but I understand that there may be some discomfort about doing that right now. So highlight that might be a bill for next year. But what I'd like to do, if we use the 120-day language, it creates a cap that puts the pharmacists in a worse position. So I want to strike that language.
Can we go back to the original
Just strike it all.
strike it off? Okay. Anybody have a problem with that? Just striking lines 11 and 12?
It's not just the lines 11 and
Nope.
12, it'll be lines 11 through 21.
11 through 21. Okay. Thank you, Lisa. Okay.
Brian, I don't know,
Yes, I'm
Brian, do
sorry.
you want to provide any feedback on that? I mean, as I discussed with Dennis.
I'm trying to pull it up. Just give me a second. I was under the impression it was just item 6 we were going to strike, which.
Yeah, it's the 120 days versus 30 days.
Okay,
versus-
that is item 6. Okay, yep, it does have, it is the correct lines. This is correct.
Okay, so you're good with that?
We don't like it, but we understand.
Okay. Yeah, I know I've already been given a premonition about another bill. Okay, can I have a motion on the amendments to House Bill 374, please?
Move the amendment.
Second.
Okay, so I have a motion and a second on the amendments to 374. Any further discussion? Seeing none. Those in favor of 374, please say aye.
Aye.
Will there be any opposition? Okay, can I have a motion on, we just did the bill as amended, right? So it is unanimous. And we will go now to House Bill 785.
Thank you,
And-
Chairwoman.
Pardon?
I just said thank you.
You're welcome. Okay, so we're going to 375, which is health insurance, step therapy, or fail first protocol revisions. And I know there was a lot of hard work between the last time we met and this time. So Lisa, you want to talk about the changes we have in this bill now?
Sure. So on page 3 of 5, lines 22 to 27, this was the behavioral health language that we had discussed that will be struck. And on page 4 of 5 and line 7 through 9, we strike the words physical harm or mental harm. So those were the two, I think, points we were still stuck on after the last meeting.
Okay. Which page is the striking the physical harm and mental harm?
Page 4 of 5,
Which
line 7 to 9, well,
Okay,
it's line
thanks.
8, actually.
Okay, okay. All right, now, first of all, before we move, I just want to make sure that people understand we are not abandoning the mental health medication issue. We are going to put it into the study that's going to be over the interim in utilization review and prior authorization. We in the discussions that I was having with advocates, we realized this is a much bigger issue. We could not come to consensus around it. We felt like we need to have a discussion within that context, but probably a separate discussion about the mental health medications as part of that study, that work group. So please know we're not abandoning it completely. We understand that there are still issues and we want to address them in that way. So we have those two major changes in the last time you saw it. Is there anyone who would like to ask questions or have a comment about those? Seeing no hands, can I have a motion on the amendments, please?
Move the amendments.
Second.
I've got a motion and a second on the amendments. Those in favor of the amendments, please say aye.
Aye.
Anybody opposed to the amendments on the committee? Seeing no hands, can I have a motion? It's unanimous. Can I have a motion on the bill as amended?
Move the bill as amended.
Second.
I have a motion and a second. All those, any discussion? All those in favor, please say aye.
Aye.
Will there be any opposition? Seeing none, it passes unanimously. Again, I just want to say thank you to all of you who worked on this. It was hard, and I am grateful for your commitment to continue the work this summer. Okay, so the next bill I want us to talk about, and we have probably 25 minutes. So there is a relationship between House Bill 815 and 1217. So we're going to start with 815. We're going to spend a few minutes looking over the reprint and changes that have been sent out, giving folks a chance to ask questions. And then we'll move to House Bill 1217 and do the same thing with that. So Lisa, you want to walk us through the changes in 818, please?
So originally, as this bill was introduced, it would have established a mandate for different types of breast and lung cancer screening. We had taken care of a lot of the breast cancer screening in a prior bill, so that was struck out of this bill just to make sure that there weren't any inconsistencies. So what is left in the bill of the original mandates is just for the lung cancer screening. And then if you look at page 4 and 5 of the reprint, we had to tweak the language having to do with high deductible plans. So then the second part of this bill was requiring the department to establish a breast and lung cancer screening awareness program. The department has indicated, they have a couple of different programs that cover a lot of these, the requirements of the bill. So they have suggested language that you'll find on page 5 of 5 of the bill under line 12. It's this new section 2. And the language would require the department to do an assessment on current outreach, education, and health disparities in cancer screening. And they're going to include the biomarker from the next bill we're going to discuss in this assessment, and then report back to us by January 1st, 2024.
Okay. Is Delegate Fennell here? I don't think so. Okay. So let's open it up to questions from, and I'm looking actually for Delegate Tolles or Delegate Wilkins. Okay.
I am here, Madam Chair. This is Delegate Tolles.
Oh, hi. Okay, great. Delegate Tolles, have you had a chance to read the reprint?
Of 1217, no.
On 815.
No, I have definitely not on that one. No, I
Okay.
think Delegate Fennell is carrying that one.
Okay, and Delegate Fennell, I don't see her. All right, so is someone from the department here who can kind of talk us through? Marie Grant. Marie, you want to talk us through what you're accomplishing here and how we got to this place?
Yeah, thank you, Delegate Cullison, for the opportunity. So HB 815, I think the original language of the bill, there was some concern from our internal experts that we were creating a new program that was potentially duplicative of some of our overall cancer screening programs that we do have at the Department of Health. I think that all being said, we recognize that there is this policy need and desire to make sure that we're doing our outreach and education in an equitable manner, and to make sure that we're addressing health disparities in screening. And so the language that we've proposed, and I apologize to everyone because I just got sign off to share it not that long ago, would require us to do an assessment of where we are today, and to have as part of that assessment a stakeholder advisory committee provide input. And that was the language regarding the stakeholder advisory committee closely tracks an amendment that was proposed for HB 1217 for biomarker screening specifically. But I think the department felt that this would be a useful exercise for really looking at all outreach regarding cancer screening and disparities, and so including biomarkers. So I also just want to be clear that we do have a reference to biomarker screening as part of that assessment in this language.
Okay. Are there any questions from the committee? I do know that I've been asked to allow the Legislative Black Caucus to review this language and get back to us with information. That's why we're holding it. But does any, and I see Delegate Taveras, you have some question or feedback?
No, just a question. I'm looking at the amendment for 815,
Right.
which is, I think, Amendment 2 on the high deductible bill. And I'm just trying to follow what it says. I'm sorry if I'm just not reading it correctly. It says that if an insured or enrollee is covered under a high deductible health plan, an entity subject to this section may subject follow-up diagnostic lung imaging to the deductible requirement of the high deductible health plan. That second part of the sentence left me, it went right over my head.
Delegate Taveras, that language is included in there so that we can comply with federal law.
Right.
And so that's the language that MIA has advised us is the best language we can come up with. If we mess with the cost sharing for this, we could put, I believe it is our the high deductible plans at risk of not being able to have a health savings account.
Right.
I'm not
be exempt from tax. So that's what this language is in there.
I'm not debating that.
Right, but that's why that language is there. It's to make sure that we.
No, I understand that, but does it read correctly? May subject follow-up diagnostic. I don't know if that's the way it does. I don't know. I don't understand it. It doesn't read.
It's saying that those follow-up diagnostic tests can require a deductible.
Will be subject to a deductible. So she put the verb before the noun basically here.
Okay.
Okay.
I mean,
okay.
I would just say subject to a deductible, but maybe that's.
Okay. Are there any other thoughts or feedback on this? Danielle Varanian?
Good afternoon, Madam Chairwoman, Danielle Varanian. We are the advocates that are working with Delegate Fennell on this bill.
Oh, great.
The main concern that we have with the amendments deals with the breast cancer screening and diagnostic portion. We are completely supportive of the Komen bill, but our bill does go a step further, and that's where our concern comes in. What this bill does, House Bill 815, it includes diagnostic image-guided biopsy, and the Komen bill doesn't include that diagnostic image-guided biopsy. And unfortunately, image-guided biopsy is one of the more expensive of the diagnostic studies that's out there. So we just want to make sure that in conjunction with House Bill 376, that we're including all of the necessary diagnostic imaging studies that are out there. So, you know, if we could massage that language a bit to make sure that we are including that, we would appreciate it.
Okay, thank you. I'm gonna look for someone representing the carriers and ask for some feedback on the impact of including the breast biopsies in this, either in this bill or in House Bill 376, which we could potentially do through the crossover process. Matt Celentano.
Thank you, Delegate Collison. I just got the request to look into it within the last hour and have sent it along to all the carriers to try to get feedback, but it is unfortunately past close of business, and I don't think we're going to get feedback from those particular carriers today, but we will certainly be in touch as soon as we hear anything.
Okay, thank you. So we'll get information as we can. Delegate Tolles.
Thank you, Madam Chair. I think Delegate Fennell should be getting on momentarily. Is she
coming in on her phone? Do you know?
I'm assuming so. I think so. I texted it to her phone.
Okay. Delegate Fennell, are you here?
Yes, I texted her as well.
I'm here. I'm here. Sorry
okay.
about that. Do apologize. I had an appointment. I'm sorry.
No,
I do apologize.
Not a problem. You're here now, so that's good.
Thank you.
So what we heard from Danielle Varanian is the one of the outstanding issues with this second version reprint is leaving out the image-guided biopsy for breast cancer, and out of this bill or out of the House Bill 376, which was the breast cancer bill. And I've asked the carriers to see if they could find out what the impact of that would be. And they've said they've reached out, a representative of the carriers said he would reach out and see if he could get some information in a fairly quick turnaround to help us evaluate that.
Yeah, that is so important. Thank you, Bonnie. That is so important. As you know, personally, I've seen so many, God knows, I've seen so many that just couldn't afford it, Bonnie,
Right.
God. So we want to make sure that we keep that in there so we can continue to address the issue of the imaging and the screening. Okay.
Delegate Collison, we do have the cross-file to House Bill 376 that has passed over. So
it has. Okay.
Yeah. Okay, great.
Okay. So, so we have a couple of options here. So let us ponder it overnight. I expect that we will be meeting tomorrow, and we can talk further about how to address that issue.
I appreciate it. I appreciate it. It's unfortunately that I witnessed, yeah. So, thank you.
But I'm hearing that the rest of the bill is okay. The rest of the reprint is okay. I'm not hearing any other concerns on 815.
Thank you.
All right. So we're going to try to work that out.
Thank you.
And see if we can't get some resolution by tomorrow. So now I want to go to.
Thank you. I appreciate it.
Thank you, Delegate. Thanks for dropping in, and thanks to Delegate Taveras and Delegate Tolles for sending you the
Thank
link.
You.
All right.
Thank you. Bye-bye.
Bye-bye. So we're going to go to House Bill 1217. And we have, Lisa, you want to go through the changes in 1217?
So the changes in the reprint that was sent out, originally the bill pretty much had a cross-reference in the Health General article for the Medicaid provisions to the insurance provisions, so they would have been fairly identical. That was going to have quite a a fiscal note. So in this amended version, it's striking that cross-reference and the language on page 2, lines 31 and underneath of that is some new language suggested by the Department of Health, and this mirrors what they are already in the process of looking to do. Then the only other change, well, no, there's a couple of on page 3, for the carriers section, they had asked for some language. I don't think I ever heard back if they were okay with the definition of biomarker. So we still need to hear from them to see if they're okay with that. And then on the last, on page 5, there is language requiring the Department of Health to report to the governor and back to the General Assembly on the fiscal impact of biomarkers and testing coverage. And there's another requirement to that requires the Healthcare Commission to study some of the impacts of this as well.
Okay, thank you. Thank you, Lisa. Thanks for working on this. Marie Grant, do you want to speak to it?
Yeah, I just I'll describe the amendments, and then I think I didn't see Delegate Wilkins on here, and just wanted to share something she shared with me prior to the subcommittee. So you know, there were a lot of concerns about in the Medicaid program that though there are amendments that work for the commercial health carriers, just because of the nature of the Medicaid program, it's broad coverage, it's different appeal rights, and there's also no cost sharing. And so there was concern even with the commercial carrier amendments about the coverage in the bill. And so what we had proposed today was some language that would require the Medicaid program to follow requirements that are similar to a policy that is moving forward for coverage in July of this year for fiscal year 2024 for some biomarker testing relating to cancer coverage. That is something that is moving forward. It's a policy that's moving forward. But I do want to be clear that Delegate Wilkins shared that she is opposed to that language and has concerns about that language. And so I think we still have some work to do there. And then the second amendment that we proposed is a study to look at that first year of the biomarker coverage and to make just look at the fiscal impact, look at any information on testing by race and ethnicity that's available to the Medicaid program and disparities, and report back after that first full year of coverage. So I'll pause there. I see Delegate Tolles.
Yeah, thank you very much. Delegate Tolles.
Yes, I was just going to agree. Delegate Wilkins had another meeting, but yes, that is correct. We are opposed to the language that the department has put forward at this point. I think there's still some work to be done and some massaging. So, and I think we may have shared that with you, Madam Chair.
Mm-hmm. Yes. So could I ask Delegate Tolles if you and Delegate Wilkins could meet with Marie Grant in at some point early in the day tomorrow to sort of work through this, see if there's a way forward?
Yes, we're hoping to do that. I think Delegate Wilkins had a meeting that may have been helpful. And I believe that we should be meeting with the department soon to figure it out. But also there are advocates on the phone as well. I don't know if any of the advocates wanted to add anything, because we're kind of more in line with what some of the advocates that we've been working with have been and we appreciate and thank them that's been working with us, as you saw at the committee hearing. So I don't know if any of the advocates want to add anything,
Yeah.
but they have been wonderful to work with.
Thank you, Delegate. I do see Dolores' hand up.
Yeah,
Hi,
she's one of them.
Right.
thank you, Madam Chair. And thank you, Delegate Tolles. Just for discussion purposes, we did take a look at the amendments that came from the department, and I'm speaking on behalf of AstraZeneca on this particular on House Bill 1217. So just looking at the reprint and the amendments that Lisa sent around, we for amendment number 2, I think that's the language that the delegate was just referencing. And that kind of just outlines what the department will be doing or will be implementing on July 1. Because of the concern with the language, we were given 2 options, either this component, which would codify what the department is already doing, or another option to just remove Medicaid from the bill completely. We think in the interest of time, and certainly for all of the work that's been done on this thus far, we would be perfectly fine with striking any references to Medicaid whatsoever from the bill. And then the department also had amendment number 3, which we thought was good to include. So that's really where we were for their second amendment, just not doing it, just removing Medicaid altogether, and then taking amendment number 3.
Okay, great. Thank you for your feedback. Ann Seacott.
Thank you, Madam Chair. Just to say that on behalf of the American Cancer Society Cancer Action Network, we are so grateful for the leadership from Delegate Tolles, as well as Delegate Wilkins on all of this. And we are eager to work with them probably tonight and early tomorrow to try to figure out if we can get to a place that we think is going to work. We are hoping that Maryland does not get outshined by states like Kentucky and Georgia, that just the other day passed legislation with full coverage in the private market and in Medicaid. So we're going to try to get things as far as we possibly can. So we thank you for your patience as well, Madam Chair.
No, thank you. Thanks for your work on this. Okay, is there anyone else who wants to provide feedback on this reprint, knowing that we will hopefully get some new information and thoughts and input before our meeting tomorrow? Okay, I don't see any hands up. So given that, I would say that we have concluded the meeting for today. Please watch your emails tomorrow for follow up on these 2 bills. And I really appreciate your time and your patience. Thank you all very much. This meeting is adjourned.
Thank you, Madam Chair, for your leadership on this. Thank you.
Thank you.